This is Brent of the Brookbush Institute, and in this video we're going to go over Tensor Fascia Latae, or TFL, self-administered release technique. I'm going to have my friend Melissa come out. She's going to help me demonstrate this technique. Before we get into the technique itself, it does help to know a little bit about the anatomy of the Tensor Fascia Latae, where it's located. All right, so if you guys know where your ASIS is, it's just posterior to your ASIS, your anterior superior iliac spine. But let me take it a step back. If you don't know where your anterior superior iliac spine is, find the top of your pelvis, which a lot of people call their hips, which is weird because your hip joint's down here. This is your pelvis. And so if you find the top of your pelvis, your iliac crest, as it's called, and you follow it anteriorly, all right, towards the front, eventually you'll find this bony notch before it all becomes soft tissue. Well, firm tissue in Melissa's case because she's got a six-pack going here, right? Must be nice. But this bone right before this softer tissue, being her rectus abdominis and her obliques, is her anterior superior iliac spine. So right behind that, this soft tissue in here, which I can actually feel some pretty dense fascicles that are probably going to give her a little tenderness already. That's her Tensor Fascia Latae. Now the next question we have to answer is, how broad and how long is this muscle? So if we follow the ASIS and go back up the iliac crest, and then we find the greater trochanter just a few inches below it. So the greater trochanter is another bone, another notch that you can feel right here that's more related to where your hip joint actually is. So one of the tricks you can do is if you lift your leg and then put it down, lift your leg, put it down, you guys might be able to feel the greater trochanter moving underneath the skin. That might help you palpate. So if we go from iliac crest to greater trochanter, that's approximately the length of my TFL. And then if I know where my greater trochanter is, I actually know the breadth as well, because it goes from ASIS to just posterior, a vertical line from the greater trochanter, right? So we got this about this width and the length from iliac crest to greater trochanter in kind of a triangle shape. That's what you're gonna search with one of our release tools. You got that? Yep. Now we're going to add pressure by having her lay down on top of one of these release tools. And we have a few ways to go. We can go cheap and just grab any ball will work. We use softballs a lot for home exercise programs. This is one of those sandbell type weighted balls. They tend to work really good if you happen to be in a gym that has them. If you want to take it a step up from there, we do love our Trigger Point materials, and we got a little partnership going with them only because I was already using their product. I do happen to like it. One thing I like about their products is it's PVC pipe rolled with foam. So as the foam breaks down, as you get more advanced, it actually gets harder, as opposed to a lot of our foam roll products that tend to get softer as you use them, which is not going to be good for your progression. And then if you really want to take it up a notch, it is at a little different price point, but for the technology it is, it's really affordable for the technology it is. This is a new product we've fallen in love with called the Hypersphere from Hyperice. And what this does is it vibrates. It vibrates at a very high frequency. Yeah, so by adding vibration, what I would assume is happening is, on top of stimulating Golgi tendon, organ, and Ruffini endings to help us get autogenic inhibition, we're gonna go ahead and also stimulate our Merkel's and Pacinian corpuscles, which are vibratory receptors, which may also help us with inhibition, at least based on the clinical outcomes and what we've seen in practice. You get really great and effective release from this, and maybe even releases a little bit faster than you do with something like a foam roll or a ball. So I'm going to turn this thing back on, and I'm just going to start it on the low setting here for Melissa. Yes, please. She's going to go right into that area that we were just talking about. All right, so just behind ASIS, we want to stay off of bones. You're not going to foam roll a bone away. I want her to roll from ASIS back towards her glutes, but not on her glutes, right? And she can roll in between her iliac spine and greater trochanter. And what she's going to look for is the most tender spot. that most tender spot we're going to assume is our tender point or our trigger point. Everything else could potentially be a satellite site, which is essentially a referral pain pattern that comes from the original trigger point itself. So you don't want to just chase down every spot, guys. You do want to find the most tender spot, and once you find it, you want to hold. From there, we can kind of mess with her posture here a little bit. We probably could make some improvements. I'm going to have you bring this leg up, actually, right? And then you can kind of use this leg to help take off some pressure. And then I want her to straighten this leg out so that the TFL is in a somewhat lengthened position, right? But I do want this leg relaxed. So I'm asking her to go ahead and let her knee soft, because what I don't want her to do is use this leg. Go ahead and lock your knee again. I can tell she's pushing down into the ground here, right? And now if we think about what the TFL does, it is an abductor. She's probably using a stiff leg and pushing down in the ground to contract her TFL and do something called guarding. We want no guarding. We want that muscle totally relaxed so that we get the best release possible. Now, who's going to need a tensor fascia lata release? That's a very important question. This isn't something that you just throw at anybody for any reason. This should be something that is targeted and aids in improving the quality of human movement based on your assessment. So if we were going to talk about something like the overhead squat assessment, the tensor fascia lata is an internal rotator, flexor, and abductor of the hip, which means knees bow in, knees bow out, anterior pelvic tilt, excessive forward lean are all signs that may potentially indicate overactivity of the tensor fascia lata. If you're using goniometry, a lack of external rotation, right, since this muscle is an internal rotator, would indicate a potential need to release the TFL. And then in a somewhat paradoxical fashion, if somebody lacks internal rotation, that also might indicate TFL overactivity, especially if you're measuring internal rotation at 90 degrees of hip flexion. That has to do with arthrokinematic dysfunction and the fact that the TFL will also anteriorly and superiorly glide the femoral head in the acetabulum. So, knees bow in, knees bow out, anterior pelvic tilt, excessive forward lean, internal or external rotation during goniometry are all potentially good reasons to do your tensor fascia lata release. You want to try the other side? All right, let's have you get set up one more time. You will notice that we have a mat down. This can get quite uncomfortable to hold for a couple minutes as our release techniques take time. I do see a lot of people rush through their foam roll techniques, rush through their mobility techniques in general, which includes stretching and even our self-administered joint mobilizations. We want to make sure that once we do a technique, we do it right so that we get the result we're looking for. I used to hate when my mother told me the fastest way to get something done was to do it the right way the first time, and you're like, "Arr!" Right? You're like, because it just takes long and I just want to get it done, but it's going to take a lot longer if you kind of half-ass it over and over and over and over again to get the result that you're looking for. How does that hypersphere feel? Fast. Yeah, it's a little intense the first couple of times you did it. Now, of course, if she was in so much pain in this position with this hard, small object, right? Because if something is small and if something is very firm, we end up having a lot of pressure, right? Because the surface area is very small. What I could do is go, hey, it looks like you can't relax into this position, and if you can't relax and you're going to guard, we're not going to get a release. So what I could go back to do is, let me have this. Let's go ahead and try this with a foam roll. See how that feels. Don't automatically assume that more pain is better. More pain is not better. A better release is better. So if she feels more comfortable on a foam roll and she can actually relax and get a release, this is where we can start. Over time, we can decrease the surface area or increase pressure by maybe using a harder object. And of course, with all of these techniques, we want to make sure that we assess, address, and reassess. I hope you guys have enjoyed this video. Take some time to practice this before you give it to your patients and clients. I think you'll find that there's little form cues and stuff that you'll pick up just by trying to figure the technique out yourself. If you have any questions, please leave a comment below.